Urinary tract infection means that the urinary tract is infected with tiny microscopic organisms called bacteria. Normally, urine is sterile or free of bacteria, but bacteria live quite nearby in the rectum. They can get into the urinary tract through a lapse in hygiene, sexual intercourse, or some other problem. In addition, some patients are genetically predisposed to urinary tract infections. Once inside the urinary tract, bacteria can begin to multiply. Anytime foreign bacteria begin to grow where they shouldn't, your body reacts by trying to fight them off. The battle between your body and the infection leads directly to the symptoms you feel. If the organisms collect in the urethra, they will cause it to swell and become inflamed. This is what doctors call urethritis. More often, the bacteria will begin to multiply in the bladder. A bladder infection is called cystitis. Both urethritis and cystitis can cause abdominal pain and painful and frequent urination. Since the urethra is shorter and more accessible in women than in men, it's easier for bacteria to invade a woman's urinary tract. That's why younger women get urinary tract infections more readily than younger men. But as men get older, they develop another problem that can lead to urinary tract infections. Typically, their prostate glands enlarge. Since this gland surrounds the urethra, it slows the flow of urine out of the bladder. When the urine backs up in the bladder, it provides a breeding ground for bacteria to grow and multiply. In both women and men, infections also develop in the ureter and the kidneys. Sometimes an obstruction like a kidney stone or some other problem may cause urine to back up and provide another breeding ground for bacteria. If the infection reaches the kidney, it is called pyelonephritis, and it can be very serious. Untreated pyelonephritis can result in kidney damage and, in extreme cases, kidney failure.